Good morning. My name is Bit. I'm a FNP student, and I'm going to do today musculoskeletal examination. I have Mr. Patel here, and do I have your consent and permission to record this video, submit on YouTube for my professor?
Yes.
Okay, so got the consent. So starting with the musculoskeletal system, we're gonna check today patient finger, arm, wrist, elbow, shoulder, neck, head, and then we're going to check the patient feet, toes, ankle, uh, and knee, and hip, and the spine. So we'll start examination with the inspection. I'm going to inspect the patient. The arm, patient the wrist, elbow, shoulder. I don't see any kind of deformity, any wound, or any kind of abnormality or nodules at this time. And the patient's skin is normal for ethnicity. There is no cyanosis, there is no discoloration of the skin present at this point, and I don't see any kind of swelling. So now I'm going to do the patient palpation of the patient fingers, checking for the distal, proximal, and uh, carpal, metacarpal bones here. That I don't see any kind of swelling, no pain, any tenderness pain, no tenderness, no pain, no swelling. I don't see any redness. Patient hands, fingers looks normal. Checking, palpating the patient wrist, checking the ulna and the radial bone. There is no swelling, no deformity. Now I'm gonna do the range of motion for the patient fingers and the hand by asking patient, can you make a fist, both hand? Okay, can you open up? Okay, now can you do your extension? Okay, can you flex? Perfect. So patient was able to do that, and now we're going to do abduct. And can you adduct? Perfect. And patient was able to do that. So that was the finger range of motion. Now we're going to do the range of motion for the wrist by asking patient to flex the hand, and flexion, and what is called another one, extension. So extension 90 degree and flexion 90 degree. What patient able to do that? Any pain, anything? No. And now we'll check the patient ulnar and medial, ulnar and radial range of motion by asking patient to, can you do the medially, can you turn your hand medially? Perfect. And can you do laterally? Perfect. Patient able to medially, laterally without any pain. And now we'll move on to so while we at the wrist, we're going to do a couple of the specialty tests called the tunnel test and the fennel test. So for the tunnel test, I'm going to ask the patient to flex the wrist, and I'm going to tap with my middle finger at the medial nerve and checking for the patient any kind of numbness, tingling, or paresthesia. Let me know if you feel anything. Any numbness, any tingling at the medial line here?
No.
No. So patient denies any kind of numbness, tingling, so doesn't have a carpal tunnel syndrome. Now we're going to do the fennel test by asking patient to do the prayer position, opposite, and put your hand, okay, little bit more, perfect, and asking them to apply the pressure for 40 to 60 seconds, and check for any kind of paresthesia, numbness, or tingling over the palm area. Do you have any pain or tingling? No. There is no pain, no numbness, no tingling. Fennel test is negative, which is shows that there is no carpal tunnel syndrome for the patient. Now we'll move on to patient inspection of the elbow. For that, we're gonna check the patient. We're gonna inspect the patient the carpal process, which is right here, right here. There is no pain, and there is no deformity, abnormality at this point. I see the lateral or lateral oleosis, which is also called a tennis elbow, and medial oleosis, that called the golfer or the baseball elbow, which doesn't have any pain. Do you have any pain or numbness or tingling here? No. And the surface of the ulnar process is it's normal. There is no pain. And now we'll did the inspection of the elbow. Now we're gonna move on to range of motion for the elbow by asking patient to flex. Can you flex? Perfect. Can you extend your arm? Perfect. Patient was able to do that. Put your Okay, flex it and extend. Perfect, able to do that. Can you do the supination? Okay, like you're holding a soup. Okay, now pronation, patient able to do that. So elbow range of motion is good. Now we'll move on to patient, yeah, but now we move on to patient shoulder. For we already inspect the shoulder for any kind of deformity. The symmetrical shoulder is symmetrical. There is no drooping of the shoulder or any swelling at this time. I see. If the patient would have been in the clinics, I would have had a patient in the gown where I can able to open up. But the video purpose, I'm just going to check it over here. So now we palpate patient shoulder for the AC joint, which is acroclavicular joint, acromoclavicular joint, which is right here. And then we'll move to coracoid process, which is right underneath right here. Then we move on to patient's tubercular process of the humerus. Humerus is right here, and that's at the back side. This side is the subdeltoid bursa, and patient bicep growth is normal too. So any pain, any tenderness here? No. So same thing we'll do on the patient other side. Check for the patient AC joint, and then we check the patient coracoid process. Then we'll check the patient tubular of humerus, and then we check the subdeltoid bursa and the bicep growth. And there is no pain, no tenderness at this point for on palpitation on the both side. Now, well, after the palpation, we'll do patient range of motion for the shoulder by asking patient to uh, uh, do the flexion. Sorry, for extension, which is 90 degree on top. Can you do extension? Okay, and flexion. Put your hand down straight. Perfect. And we're gonna ask the patient to do abduction, which is AD, away from the body. Now we'll ask the patient to do the adduction by asking the patient to, can you do that? That is adduction. With your one hand fold and try to touch here. That's the adduction, which is going to touching the midline. And with the same other hand, which patient able to do without any kind of problem. Now we'll do the external and internal rotation of the shoulder by asking the patient to try to put your hand at 60 degree. Perfect. That's internal rotation. Can you do with another hand too? Patient was able to do on the both hand. Now we'll do the external rotation by asking patient to try to hold or try to touch the opposite side of the scapula, which is external rotation of the shoulder. And can we do on another hand? What patient able to do on the both hand without any kind of problem, which is normal. Now we'll do the specialty test called the empty can test. We can do the both way, either patient standing up or sitting up. Because of the video part, we'll do the sitting position by asking patient to put the hand on the flexion straight up. Can you put your hand straight? And can you try to, oh yeah, like you're holding the empty can, by putting the patient, showing the thumb for facing towards the floor. And now I'll ask the patient to, don't let me push it down, okay? Yep. So I'm going to put the pressure and we'll see if patient able to do that. Patient has a pretty good strength on the both shoulder. That shows the patient does not have rotated cuff, and the strength is equal. So empty can test is negative. So we already did the inspection, we did the palpitation, we did the range of motion and the specialty test. Now I'm gonna move on to patient neck and head examination. Patient neck and head is symmetrical. There is no abnormality I see or swelling or any kind of open cut or wound at this time. Patient trachea is in midline position too. Now I'll move on to patient palpation. So for checking for the head and neck palpation, we'll check at the using my two finger from the medial process of the TMG joint, which is right here, by asking patient to open. Can you open your mouth? Patient can able to open the mouth without any problem, and there is no clicking sound or pain I heard. While we're doing the patient neck, we'll ask the patient to, can you open your mouth and do side to side? Yeah, patient was able to do side to side, and with your three finger, can you you don't have to put in your mouth, just can you open your mouth and see if your three finger goes? Perfect. Yeah, so patient was able to do that with the range of motion. And while we're doing the patient neck and head, we're gonna check the patient uh, neck on the back side for checking patient in on this side. Okay, that side. Okay. So we're gonna check the patient shoulder for patient backside with this cervical spine, which I don't see. Do you have any pain or anything? No. Pro prosacral cervical muscles, which is right in the back here. Patient doesn't have any pain, anything. I'm checking patient trapezius muscles. Any pain, anything? No pain. And I'm checking the patient the clavicular sternal muscle, and patient does not have any pain or tenderness. Do you have any pain? No pain. So we have done here our head and neck palpation. We'll do range of motion for the neck by asking patient to, can you touch your chin to the neck? Yeah, patient able to do that. Can you flex your neck looking at the ceiling? Patient able to do that. Now we're going to do the rotation. Can you look at your right side? Can you look at your left side? Patient was able to do that. And while we checking range of motion, where we can ask him patient if they're able to rotate the neck up and down if they don't have any kind of cervical problem. So once we're done with our range of motion for the neck, I will check for the specialty test called the Sperling test. To perform the test, I will ask the patient to flex the neck up and turn the lateral side and applying the pressure from the apex of the head to downwards to check for any kind of spondylosis or cervical uh, problem. If the patient complains of paresthesia or the numbness or tingling, that means the Sperling test is positive. So for that test, I will ask the patient to flex the neck and turn to lateral side, and I'm going to use my two hand applying the pressure on the apex of the head to downward and asking patient, do you have any pain or paresthesia or numbness, anything here? No. And we can do the same test on the other side of the neck to check for any kind of pain, paresthesia or tenderness. The Sperling test is negative. Patient doesn't have any kind of pain or numbness or tingling. So once we done with our head and neck examination, now I'll move on to patient feet. So we already done tunnel, fennel. Okay, so now I'm gonna move on to patient feet examination. So can you put your leg here? So I'm going to do patient inspection of patient feet, toes, ankle. Then I'm going to do the patient palpation and then range of motion. So for inspection, I can see I do not see any kind of swelling of the joint. All the toes and in the normal shape and size. There is no deformity or any nodules at present. I don't see any kind of cones or plantar warts, uh, callus, or bulin, which is a larger toe, or its toes are pushing outside, but patient doesn't have anything, and no, and I see the patient leg has a normal curve, so which is patient doesn't have a flat feet, and that's the inspection. Now I'm going to move on to palpitation of the toes. I'm checking the patient toes for the distal, proximal, and the metatarsal bone, which doesn't have any kind of deformity or any kind of swelling, pain, or any tendon. Do you have any pain, anything, sir? No. And I'm going to check the metatarsal bone, and nothing. And patient doesn't have any kind of digitalis neuroma, which is right. Sometimes we can see on the other side of the feet for palpation, which I don't see anything, and patient does not have any kind of plantar fasciitis. While palpating, patient doesn't have any pain. Do you have any pain, anything here? No pain, so does not have plantar fasciitis. So no digital neuroma, no plantar fasciitis, and palm has a curvature normal, so that he does not have any flat feet. We can do the flat feet thing by asking patient to stand up also, but with here I can able to see the normal curvature of the feet. Now I'll move on to patient ankle examination. Looking at the patient ankle, I only inspect there is no swelling, see, or redness. Now I'm going to palpate the patient ankle and check for any kind of pain while checking the patient lateral muscle, olliculus joint, and a medial olliculus joint, which is I can show you right here. I think we can see it's right in the middle. So lateral olliculus joint and the medial olliculus, and there is no pain, no deformity, no swelling or any kind of nodules I felt at this time. So for doing the range of motion of the toes, I will ask the patient to can you uh, okay, can you do like that?
Yeah.
Okay, patient able, can you flam your fingers? Perfect, patient was able to do that. Can you rotate your feet? Perfect. Can you rotate laterally? Perfect. So patient was able to do medially and laterally. Can you able to, I'm going to hold you, can you able to round your feet? Like, yeah, perfect. Patient able to do the rotation of the ankle joint too. And so the range of motion of the toes are good. Patient doesn't have any kind of problem or pain by doing that. And while doing the patient ankle, we can ask the patient to flex and pronation. Patient doesn't have any problem doing that, and we already check the patient ankle joint movement by asking patient to rotate the feet. Can you do one more time so they can see? Perfect. There is no problem there. So we already did the patient feet, toes, and ankle examination. We did the range of motion, palpation, and the inspection, and there is no visible abnormality or any kind of deformity seen at this time. Now we'll move on to patient a knee joint. So for the knee joint, we're gonna check the patient knee, inspect the patient knee for check for any kind of swelling, redness, or any kind of open cut or wound at this time, which I don't see that. I'm gonna move on to patient palpitation. So we're gonna check the patient suprapopliteal fossa, which is right here, and which is normal. I don't see any kind of fluid collects or anything. I'll look at the lateral side of the popliteal bone. This is the medial side, and this is the lateral side, and I don't see any kind of swelling. It's pretty normal in the shape and size. Now while I'm checking here, I'm going to check the patient popliteal fossa for the Baker's cyst by using my two hand at the back side of the patient's leg and just palpate, and I don't feel any kind of Baker's cyst on this side. I'm going to do it on the patient other side, which I don't feel anything for the Baker's cyst, and it's normal. So while we do the examination, I'm going to use the same for the both leg simultaneously, right and left. So same thing, we did the inspection of the right leg. Now I'm going to the left leg. We check the inspection. There is no callus, uh, there is no callus ward or the plantar ward. Patient feet is just, has a normal curve, so it's not a flat feet. Patient doesn't have any kind of digital neuroma at the site, and digitalis and proximal metatarsal bones are normal in shape, and the patient doesn't have any plantar fasciitis. So same thing we did other side. We check on this leg, and range of motion also we checked in the both leg by asking patient for the toes and the feet. We'll ask the patient, can you curve your feet? Perfect. Can you flex feet? Perfect. Okay, can you extend? That's a flexion and extend, that able to do that. And can you move your feet up and down? Perfect. So patient was able to do that without any problem, and there is no nodules or tenderness or pain felt at this time. And we already did the inspection of the uh, left knee also and the right knee also. So now we move on to patient. There are a couple of specialty tests that we do for the knee joint. The one is a Vargas test, Veras test, Lachman test, uh, drawer test, and a McMurray test. Those are tests for used for the knee joint for finding out any kind of ligament tear or meniscus tear, or any kind of other abnormalities. So for that, I'm going to do the Vargas test. So we can do Vargas in two way. We can ask the patient to lie down, or we can have the bed at supine patient spine position by using the patient knee flexing at the 20-degree. So with this test, we can do.
You can lie down.
Okay, you can lie down there. Perfect. So I'll make the patient lie down and then we're gonna start doing the patient test here. So for that, so for workers test, what we're gonna do is that normally we can use that leg, but it's fine, we can use it here by holding the patient knee at the 20 degree, and my dominant hand, I'm gonna hold the patient ankle joint here and support the patient into the femur, turning the patient tibia to internal rotation and abducting away from the body. I'm going to put the pressure, asking patient, do you have any pain, anything? No pain, nothing. We saw negative Vargas test. And for the varus test, what we do the same thing, but we're gonna do adduct. Instead of going out, we're gonna push the pressure inner side. So same way, we can hold the patient leg, apply the pressure, internal rotation, and put the pressure in, which is adduct, and patient doesn't have any pain at the joint, which is negative for the Varus test. We'll move on to patient Lachman test. For Lachman test, what we do is that we ask the patient to bend the knee at 20 degree and using your undominant hand supporting the patient humerus or the thigh about just about the knee, and holding the patient knee side and applying the pressure up and in. Check for any kind of PCL or TCL tear, which is not there. Patient doesn't have any kind of pain. Do you have any pain, sir? No. Okay. Now we'll move on to patient drawer test. For drawer test, I'll ask the patient to bend the knee completely, and I'm going to sit on patient knee here, and using my hand by the patient popliteal fossa, my fingers and my thumb should be at the patella bone, and I'm going to do pull outward and then put inward to check for any kind of meniscus tear. Any pain? No. So patient doesn't have any pain, which is normal. Our patient, if patient has any kind of tear to their meniscus, so it's going to be a painful. Now we'll move on to patient McMurray test. For the McMurray test, I'll ask the patient to lift the feet up, and we're gonna fold it and push towards the patient abdomen. Hold it here, push patient towards abdomen, and then we internally and externally rotate and see for any kind of patient has any pain to his back, which I don't see anything. Do you have any pain, sir? No. No pain, which is the McMurray test is negative. Patient doesn't have any kind of meniscus tear or any other deformities or painful. So while the patient is already lying down, I can do another test, which is a Thomas test for the hip joint. Then I'll do Patrick test, and one more test is for the spine, which is a straight leg test. I'll finish all the tests while patient is lying down. So for the hip joint, I'm going to do the Thomas test by asking patient folding the patient leg. This is it. Okay, holding the patient leg and folding flexing towards the abdomen and pushing the pressure by asking patient if he has any pain to the opposite side of the groin. Do you have any pain? And while we're doing that, we can check the patient back for the any kind of lumbar lordosis, which I don't feel anything, and patient denies any pain on the other side, which means the Thomas test is negative. For the Patrick test, that is used to check for patient has any kind of lumbar disc problem or the lordosis, by asking patient to fold the knee, put it on the other legs just above the knee, and using my dominant hand to press the pressure here and my undominant hand to support the femur, and pushing the pressure. If I put the pressure and patient knees fall off from the other leg, that shows it's positive Patrick test, which I did test, and patient knee doesn't drop or fall from the other leg, which means Patrick test is negative. Now one more last test is a straight leg test. So for that, I'm going to lift the patient leg and try to go at 90 degree, how much patient able to do without folding the knee joint. Okay, so I'm going to help you to go, and tell me if you have any pain, anything to your back, any pain, anything. So if the patient complains of pain, that could be either sciatica or any kind of spinal lower spinal pain for the patient's lumbar region. But patient denies any pain, there is no tenderness or any radiating pain at this time. So the straight leg test is negative too. So now we move on to patient hip examination. A little bit lower. Okay. Now we're going to do patient the hip examination. For the hip examination, we're going to inspect the patient hip. So normally when the patient walked in, I always normally observe the patient, the way they walked in. A patient is kind of having difficulty walking, has using cane or anything. I'll observe when the patient comes to the clinic. So here with this exam purpose, I'm going to check the patient in the supine position by checking patient anterior iliac spine by holding on the both side. Check for the any kind of tenderness or anything, which I don't feel any pain, anything, sir. No pain. So anterior iliac crust is normal, and I'll check the patient greater trochanter of the femur, and there is no pain, any pain, sir. No pain. And now I'll ask the patient if you can you able to turn in your tummy, so I can check your posterior iliac. Okay. So now at the patient lying supine position, I'm going to check the patient posterior iliac spine. By touching here, any pain, anything? No pain. And at the same time, I'll look at the patient's sacral region. Sometimes you can see the patient has a two dimple thing, that is the normal for the sacral joint, and there is no other deformity at this point. And while patient is lying down this way, I'm going to check the patient range of motion by asking patient, can you able to lift, fold? Patient able to fold, that is duck. And can you able to lift your leg up? Patient was able to do that. Okay. So and while we do that, I'm going to check the patient range of motion, internal rotation, external rotation, and adduction and abduction. So while he's here, can you move your leg towards me? So that is away from the body is adduction, and patient was able to bring back the leg inside without any difficulty. Any pain, anything? No. Okay, can you turn back? Now we can do in the front. So while patient lying down straight, we're gonna do the patient's internal external rotation, active and passively. So I'll help you first, and then you do it yourself. Okay. So we're gonna do internal rotation, and then we're gonna do external rotation. Can you do yourself? Yep. In, out. So patient was able to do that without any difficulty. We'll do the same thing here. Internal rotation, external rotation. Can you do it again yourself? Internal rotation, external rotation. Yeah. And do you any pain? No. No pain. No tenderness. Patient was able to do that. Now while the patient is lying down, we can check the patient flexion by asking the patient to lift the leg up. Patient was able to do that without any problem. We can ask the patient, can you bend? Patient able to bend it, no problem. So patient was able to perform all the range of motion without any problem. And we already did our specialty test called Thomas test and Patrick test for checking for any kind of lordosis or any kind of lumbar pain or herniation or anything. So which are negative. And you can see them. So our last test is our spine test. For the spine test, I'm going to normally I always check my patient as soon as the patient walked in, the way he walks, how the spine is looking. But for this video purpose, I'm gonna can you stand up? Yep. So patient able to stand up easily, and there is no problem standing up. I can see the patient backside spine looking straight in a symmetric position, and there is no abnormality fine. I can see the patient standing easily without any limbing or any kind of abnormal posture, and patient is standing in erect position. So spine is good. And to check for the, we'll always look for the patient kyphosis, lordosis, and the scoliosis. And to examine for the scoliosis, I will there are two ways you can do is by watching the patient the way walked in, or another way is they're asking the patient, can you stand up, and asking the patient to, I'm going to show you with the video, Can you try to touch your toe? Patient was touching, and then you look at patient's spine right here. So while you're looking at, you can see the spine is in the straight symmetrical position, no abnormality. And while you do that, you can even check, palpate the spine for any kind of pain, anything. Do you have any pain and tenderness? No. No pain. Patient was able to do that. You cannot. And there is no scoliosis. Patient spine is straight. Now I'll move on to patient palpitation and check for the patient back spine in the back. You can sit down. So while patient is sitting up here, I'm going to check. Any pain? Anything? No. No pain. Patient doesn't have any kind of pain while I'm checking at the patient's spine. And while here, I'm going to do the percussion of the spine for any kind of nodules or any kind of deformities. So tell me if that hurts you or have pain. No. And I'm going to do on the both side of the spine. Any pain? No. So on percussion of the spine, patient denies any kind of pain or tenderness. So the spine, there is no problem or deformity found during this examination. While we check the spine, we always do our general inspection. Then we'll palpate, and we already did our patient. So for range of motion of the spine, we'll ask the patient to stand up, and we can ask the patient to can you turn one side? Perfect. Patient able to do that. Can you turn towards me? Patient able to do that. Can you try to bend backward? Patient able to do that. Perfect. And patient already touched the toes by so we already checked this patient's spine. So it has a pretty good range of motion in all direction, lateral, medial, backwards, and the front. And patient does not show any kind of deformity at this time. So here we concluded our musculoskeletal system examination. So we did we checked patient fingers, hand, wrist, elbow, patient shoulder, neck, and the head. Then we move on to patient toes, feet, ankle, knee, hip, and the spine examination. So, and we cover our 12 different specialty tests today. For carpal tunnel syndrome, we cover the Tinel and the Fenel test. For the shoulder deformity, we complete our empty can test, and then we move on to our neck. For any kind of spondylosis, we did our sporting test, and for the knee, we completed 5 different tests. One is the Vargas test, Varus test, Lechman test, drawer test, and McMurray test. And for the hip, we did the 2 different tests, Thomas test, Patrick test, and for the spine, we did the straight leg test. And the patient did not have any kind of problem. All the tests were negative. And we conclude our examination here. Thank you so much.